Hey guys, it's Phil Gordon from Dental Implant Practices, and today we're going to be doing a review video of the Piezotome Cube from Acteon North America. The Piezotome Cube is an ultrasonic piezotome hard tissue bone surgery device, and today we're going to walk through the surgical device and all the tips that go with it, what its uses are, and kind of show you what you can do with it. Okay, first we're going to look at what is the Cube. The Cube is an ultrasonic bone surgery device. The Cube uses high-frequency ultrasonic vibrations that cuts dense bone while not cutting soft tissue. It provides fast and most minimally invasive method for extractions and bone surgery. What I'm doing with this in my office is doing extractions, ridge splits, and entryways to crestal and lateral sinus approaches, along with other things. This Cube has over 3 times the power of other piezoelectric devices on the market, so it's much more stronger than anything you've used before. The package cost might be upwards from $6,000 to $7,000 depending how many kits you want to get, as the kits are sold separately. You do get one kit with the purchase of the Cube, and here I have the extraction kit, and we'll walk through the kits separately, but you do get one kit with it, but they offer many different kits. What I like about this Cube is it has the main device here, it has a water control here, and then it's very simple. It has really just a couple different buttons on here. One is the D1, D2, D3, or D4 settings, so that's basically your power output. Obviously your highest power for the D1 bone, and then you can decrease power for the soft bone. And then over here you have your water output. I usually like to look at 60 or 70%, but you can increase up to 100% water output, or you can decrease down to 60%. So that's your water output and your power. So really there's only 2 controls for the Cube. So pretty simple as far as that's concerned. It does come with a foot control pedal, and so this foot pedal activates the Cube. And here we have the handpiece, and you can see it comes with a nice little holder so you can put it on your desk or clamp it on somewhere. The attachment for the water connection is here. It has a screw-on tip that lights up with LED. You can insert your tip, start to screw it in by hand, and then you can tighten with this big lug wrench, or they also provide a smaller one here for easy access. That just slides down and tightens like such. And then when you push on the handpiece, you get light, you get ultrasonic vibration at the tip that cuts hard tissue, and then you get water spray as well. So that is how you activate and control the handpiece. For the water, it does take a special type of tubing, which is very specific for this machine. So the tubing is different than your tubing for your implant handpiece motor. So these have to be bought through Acteon, I believe. I'm sure you can buy them through other markets as well. But it's very specific for that. So it's got your little needle tip that goes in your saline, just like your normal saline bag here. But then it has a special type of adapter, so it's not the same type of tubing as you would use for your implant motor. Here's the motor hookup for the tubing. This just slides open and closed, and then you have this little round wheel. It slides in and engages like such. Very easy to plug in and plug out. And then you have your other end that plugs into the handpiece. So you've got your tip that plugs into the handpiece, you've got your coil that runs through the motor, and then you've got your tubing and your plunger that runs in through your saline bag here. The foot control has a nice little pedal on it that you can, nice little handle that you can pick up and move around for ease of movement. It has a 1 button for activating the handpiece. It has a 2nd button in the back that toggles through the bone density. So as I push this back button, it goes from D1 to D2 to D3 to D4. So I can control the power output through the back button. I can activate the handpiece through the main pedal, and then I can move it around the surgery room with just my foot, so I don't have to take my gloves off and move it. So it's got a high output of water that runs through the handpiece here. You want to keep copious amounts of water for cutting so that you're not burning the bone. So I like to keep mine 60 or 70% for all cutting applications. Here we're going to talk about the surgical tips that the Piezotome Cube offers. They have an extraction kit, a bone surgery kit, a crest splitting kit, a sinus lift kit, and an intralift kit. They also have a crown extension kit and an essentials kit, which is basically just various combinations of these remixed. So we're going to run through the basic 5 here, as I think these are most applicable for implant surgery. First, we're going to dive into the extraction kit. Each of the kits comes in these little safe autoclavable containers. When you open it up, there's 6 slots for tips here. These are for extracting teeth and preserving bone. So this kit would be used for extracting wisdom teeth, fractured roots, impacted teeth, root sections, and or just teeth that are hard to extract. These kind of act as a luxator, and the tips are used to be put in the periodontal ligament space. The tip must be placed parallel to the root, and it's important to not try to lever with these, but try to just go straight down in the periodontal ligament space and to try to separate the root from the bone. So you want to kind of separate the PDL space. It cuts away bone and helps safely surgically extract impacted or tough teeth. Here we have the crest splitting kit. So this is more for ridge splits. You can see there's all kinds of different sizes and shapes of bone splitters in here. This cuts through up to 8 millimeters deep. You can see there's little 2 millimeter line markers, 2, 4, 6, 8 that you can see on the individual tips. There's some thin wedge shapes and some thick wedge shapes so that you can enter in, make your initial osteotomy, take it to depth, and then go through various widening. You can start off with narrow and then wide and then even wider with some of these larger ones so that you can predictably split ridges and increase osteotomy sizes or do bone surgeries. Here we have the bone surgery kit. In the bone surgery kit, these are intended for block grafting as well as cutting, scraping, removing bony structures, cutting out blocks of bone or anything within the hard tissue without risking cutting the soft tissue. So these ultrasonic tips there's 3 saws and 3 scalpels in there, and you want to do bone harvesting, crest expansion, or preparation for the implant site without traumatically damaging the inferior alveolar nerve and or perforating a membrane. So we have different angles on these saws, and then different obviously angles on the scalpels as well, so that you can get different types of applications with those. Here we have the sinus lift kit. This kit is for safe, straightforward lateral sinus elevation. So what this kit is for opening the window. The diamond coated tips are safe for that. So you have a couple diamond coated for opening the window. And then you have this mushroom head here for retracting the Schneiderian membrane. And then you have these tips in here for separating the membrane even further once you're inside. So you have 2 of the diamond coaters for creating the window, this mushroom tip for separating the membrane, and then these 2 spreaders here for separating the membrane completely away from the bone. So this is a nice way to open into the sinus while removing bone and not perforating the membrane, which is obviously the main goal for a lateral sinus approach. Here we have the intralift kit, which is more of a crestal sinus approach. And on here we have diamond coated burrs so that we can cut through the bone without cutting the membrane. And then we have one for accessing and lifting the membrane, which shoots water up. On all of these you have 2 millimeter line markers so that you know your depth on that. The diamond coated tips increase diameters from 1.35 millimeters to 2.8 and are designed to gradually drill and widen the access canal to the sinus membrane. The membrane elevation is done by hydrodynamic pressure shooting through this water tip here so that you can safely lift the membrane internally and then pack your bone of choice and place your implant through the internal lift process without having to do a lateral sinus window. So this is purely for internal sinus lifts, doing so safely, once again, by cutting with the diamond coat tips and then lifting with the hydraulic pressure. All right, guys, I hope you enjoyed the review video of the Acteon Cube. You can get more information about the Acteon Cube at the acteongroup.com, Or I hope you visit my website at www.dentalimplantpractices.com for more information on our blogs, our podcast, conferences we're doing, everything, keeping you up to date there. Keep watching the video series and hope to see you soon. Thanks a lot.